the latest Healthwatch Lincolnshire Talks With series. Today I'm joined by John Turner, the Chief Executive for South and South West NHS Clinical Commissioning Groups, as well as the Senior Responsible Officer for the Lincolnshire STP. This is part 2 of this interview, which focuses specifically on the Sustainability Transformation Partnership in Lincolnshire.
Perhaps just to kind of set the scene, in that there are 44 what are called STP footprints across England, and Lincolnshire is one of those 44. Obviously, we cover the 44 cover the whole of England. Several years ago now, as part of national policy, each of the areas was asked to assess what its key challenges were in terms of maintaining and developing health services, and to come up with a plan to address those. So the STP, as a Sustainability and Transformation Plan, was a piece of work that the NHS in Lincolnshire did, and we published the plan in December 2016. So it was saying, these are the problems we face, and this is how we think we're going to address them. Through 2017, as national policy developed, it became clear that not only was a plan required, but a partnership across all of the key bodies. So the STP, as well as being a plan, is also a partnership. So in Lincolnshire, it's a partnership between the 4 CCGs and the 3 NHS trusts. We also work very closely with a wide range of others, so the local medical committee, the county council, district councils, patient groups, the third sector, so on and so forth across the patch. So it's a partnership. But it's also, I think, fair to say that in more recent months, STPs are increasingly being regarded as systems. Okay. So when people talk about the Lincolnshire, particularly NHS England and national policy talk about STPs, they increasingly mean the health system in the patch. So that really is taking the partnership element to another level. So I think it's fair to say that the STP is 3 things at the moment. It's a plan, it's a partnership, and it's a system. All of which, personally, I think is a natural evolution, and it's all taking us forward in the right way. So that's what the STP is, but you could ask me, what is it really about? And in my experience, there are really 3 reasons why you'd want to change anything in the NHS. Firstly, the quality of care and outcome for patients isn't good enough, or could be better. Secondly, you can't recruit or retain the staff to provide the care. And thirdly, you don't have enough money to provide services in the way you are at the moment. Those are the 3 main reasons for change. And when you look at where we are in Lincolnshire, you would see that we're in a really difficult spot on all 3. So when it comes to quality of care, we know that our hospital trusts are in special measures for quality. We know that our A&E services are in category 4 of 4 in terms of performance. We know that our cancer standards, whilst they have improved, are still short of where we need them to be. And equally, we know that in other areas, particularly general practice, there are some general practices that are in special measures or require significant improvement as well. So undoubtedly, the quality of care isn't as good as we would like it to be as a system. Now, I just want to stress that isn't for one moment a comment on the exceptional hard work of our staff across the system. And I'm lucky because I get to see on a regular basis some fantastic work that staff across the patch do. But when you step back and look at the outcome of the system as a whole, it clearly could be so much better for the population. When we look at staffing, again, we know that of approximately 12,000 posts that we have in the NHS, employed posts in the county, we're currently carrying about 700 vacancies, of which every month approximately 400 are covered by locum or agency staff. Now there's always a place for locum and agency staff, but in the county, without them, we wouldn't be able to provide the range of services that we do. And again, in general practice, we're struggling to recruit GPs in some parts of the country. In some parts of the county. We've got initiatives ongoing to address that. But that is a really knotty issue. And then finally, on finance, the 4 CCGs together, so you could call that the NHS budget for the county in broad terms, spend, or should I say receive, about £1.1 billion a year. Considerable amount of money. But as a system, we're currently overspending by about £100 million a year. That's clearly unacceptable. We're spending money we haven't got. And clearly we cannot continue in that way. So the STP, the plan, the partnership, the system, is about coming up with different ways in which we can work so we can improve the quality of care and outcomes for patients. We can improve the issues around staffing, and we can balance our books. I think those are 3 things that the population would be expecting us to do. And then moving on to, so what does that actually mean? Fundamentally, it means that the NHS in the county, despite the fantastic work of our staff, is not fit for purpose. And that we have a responsibility to make it fit for purpose. When you look at the model that we run in the county at the moment, you would notice 3 things about it. Firstly, as we were saying earlier, it's very fragmented, and we need to move to an integrated approach. Secondly, it is very reactive, and we're not proactively managing the health of the population in the right way. And thirdly, we require far too many people to go to hospital, expensive hospital care, that it is quite possible they can receive locally. So the STP is trying to fundamentally rebalance the system in a way that it would be better for patients, there would be better quality outcomes, that there would be more rewarding work for staff to do, and people can have better careers in the NHS in the county, and one that balances our books. But the magnitude of the challenges we face shouldn't be underestimated. What we do need to clearly do is change things, but ensure that change is an improvement. So we can only do that by ensuring that our senior doctors and nurses and other clinicians are helping us identify and drive forward the changes we need, and where there are material changes to services. And I think that I'm in anticipation that there will be some coming up in the year. Clearly we need to talk to the population, engage with people, listen to them, take their ideas on board, as well as going through any the technicalities of any public consultation exercise that we would rightly be required to.
So what does the STP mean for patients? Is it the hope for improved service, and what can they expect from the STP as sort of going forward? You mentioned there that there's going to be some sort of consultation they'll be able to get involved in.
Yes, I mean we have already, as part of the Lincolnshire Health and Care process, which was an immediate forerunner to the STP, engage widely across the county about people's concerns and aspirations for the future. But in broad terms, what people will see over the course of 2018 is we're going to be coming forward with a range of detailed proposals about how we can achieve this rebalance. For example, we believe that the development of neighbourhood teams and aspects of the GP Forward View will enable a significant increase in the amount of care that is able to be delivered locally, and an equal reduction in the requirement for people to go to hospital for their care. So there'll be some building up of integrated local services, so people can expect to see that. I think that's going to be a really positive development. What people, I think, can also expect to see is proposals for the reconfiguration of the way in which our acute hospital services work across the county. And we're currently undertaking quite a lot of analytical work, and we're working with our doctors to undertake that review of acute services, and it'll, I think, be fascinating to see where that takes us. But very clearly, the current model isn't working because of the quality of care, the staffing issues, and the financial issues. So we are going to have to come up with something that we think can address all three of those, and that work is in full play. And I think it's important to stress the vital role that neighbouring to Lincolnshire hospital trusts play. So in the South CCG area, approximately 2/3 of the population in and around Stamford, Deepings, Bourne, across to Spalding, go to Peterborough for their hospital care. Patients out towards the Suttons, many of them go to King's Lynn, and obviously in the coastal areas out in the east of Lincolnshire, many patients naturally go to Grimsby for their care. So whilst some of this will be about changes in the balance of hospital services between Lincoln, Boston and Grantham, it will equally be about the role of these hospitals in supporting the health needs of the population.
Where will the resource and staff be found to invest in services in the community, including social care, to deliver more care closer to home?
You're quite right. We do need to create ways in which we can refocus staff and our resources in line with the intentions I've just described. But if you recall what I said about the staffing problems, we have too many vacant posts in the county. If you could recall what I said about the money, we're spending roughly £100 million more a year than we've got. So it's clear to me that there isn't going to be, whilst obviously we'll get increases in line with the Chancellor's budget release, and there's always a bit of ebb and flow about people coming in and out of an area for work. It's clear that the solutions lie within Lincolnshire, and we're going to have to significantly rework the resources that we have. I think if we move to more integrated working, then by definition that will reduce duplication, overlap of roles, administrative tasks, so on and so forth, and will enable more clinical time to be available for patient care. A key part of our plans for the future will be about how we use technology differently. We use technology in our, if you like, our normal personal lives in a very advanced way. I think it's fair to say that the NHS is a long way behind that. You can see lots of ways, and you identify different ways in which technology can work. But I think that we will see a rebalance between the amount of healthcare that's delivered face to face and the amount of healthcare that's delivered over the phone, over the web, Skype, or whatever other mechanisms become available. And I think as well that there will be opportunities for staff and services who are currently only operating out of hospitals to work more in our communities. So there may be areas where currently hospital staff and senior doctors could work differently with GPs and other staff locally in partnership to deliver the care locally. So there are many areas. We're currently working on 3 programmes called 100-day change programmes around diabetes, dermatology and ophthalmology. And I'm looking for those to be indicative of how more broadly the services may develop in the future.
We talk a lot about the staffing issues. What can we do to attract people to sort of come and work in Lincolnshire and sort of stay in Lincolnshire?
Well, this is something, as you can imagine, we've given a lot of thought to, and there are a number of actions that we're already taking forward. Actually, when you look at the figures, the real problem we have is that of recruitment. For many staff, once they join the NHS in the county, they stay for a long time. Obviously, there are lots of benefits of living and working in Lincolnshire. The country, the schools, it's a good place to live. Although I think you only appreciate that once you come to the county. So there's a number of things we're doing. Obviously, as an NHS, we're working as closely as we can with the University of Lincoln with the aim of attracting a medical school facility to the county. If we're able to achieve that, that'll be over years, not months. That would be a huge boost to the reputation of the NHS in the county. We've also more recently developed a National Institute for Rural Healthcare in the county, but it's a national institute. Early days with that, but that's all about creating a better reputation, opportunities for research, development, more interesting work, so on and so forth. One of the things that we're equally driven by is supporting the current population, school leavers and so on, to take up careers in their local NHS. And again, with the support of the University of Lincoln and other partners, there are more courses now beginning to emerge in the county for specialist nursing care and so on, so that people who work locally or are potentially interested in working locally will make it as easy as possible for them to join and be part of the NHS in their county. So these are just some of the range of initiatives. And there's one other thing that we've been, I think, remarkably successful at in the county. It's a piece of work that I'm very proud to be associated with, which is that the local medical committee for the past couple of years have been leading a piece of work to attract international GPs to come and work in the county. It's been hard work, but today there are 26 GPs who are working in the county, who've come to us from overseas, across Europe, some from Spain and Portugal, others from Eastern Europe, who are today providing care in GP practices to our population. They weren't here a year ago. That's been a huge boost. And such has been the success of that we're now in the next round where we're trying to attract a slightly greater number back as well. So that's a really sort of positive news story.
Yeah, brilliant. Are there plans to reconfigure specialist services by consolidating some services in fewer hospitals? Do you believe that's necessary and sort of desirable?
As I said earlier, the planning work is underway, and I think it'll be about balance. I think what we will see is those services which it is possible to provide locally, I mean very locally in primary community services basis, we will be very ambitious about that. Equally, I would be expecting there to be some consolidation of services across the county. That's certainly been the experience elsewhere in England, and I would anticipate that proposals will be coming forward for that in Lincolnshire as well. There are no absolutely specific plans or decisions at the moment. What we're doing is we're going through the 32 hospital specialties here that are available in the county on a site-by-site, specialty-by-specialty, cost, staffing, etc. basis. And we need to see where that analysis takes us.
So you talk obviously about people accessing the services sort of closer to home. Some patients may argue that they believe that's not going to happen. That they can't access their GP at the moment. Their A&Es are closing. The other services are going sort of further afield. It doesn't feel like it's coming closer to home. Is that something that's going to sort of change, or is that the way that we're sort of working, that we are going to have to travel a little bit further for those specialist services, but get a better service than sort of that localised and not so good sort of service?
Well, I think there's it's all about balance, and there's perception and reality. The reality is that for most of us, most of the time, the NHS is our local general practice. Hospitals are, in that sense, quite remote, but clearly hospitals play a vitally important part in the fabric of the health services that are available to the population. So it will be about balance and getting things right. Where things should be provided locally, we'll do all we can to ensure that that's delivered. But you're quite right, in some services and in some areas, you get far better clinical outcomes for patients by consolidating services in one area rather than spreading the limited skills and expertise you have across a wider patch. As I say, we need to see where the analysis takes us in relation to that. But I think you'll see that we'll be able to demonstrate a really strong focus on local services. I think as part of that, and I know this won't apply to every area, we'll be looking at, for example, what more we can do to support our community hospitals across the county. We are, as you would expect, committed to a future for Grantham, Pilgrim and Lincoln County hospitals. Vitally important to say that. But what the right balance of services between them will be in the future is to be determined by the analysis. And a key part of our thinking is that at the moment you'll see that in our hospital services we have a combination of kind of urgent medical services and elective surgical procedures. So it's elective and non-elective care. What we have found, that such is the pressure on our non-elective services, through the year, but especially over the winter period, that it squeezes out our ability to really undertake elective procedures in the way that we would wish going forward. And actually, over half of the elective procedures that the people of Lincolnshire receive are those procedures take place out with the NHS in Lincolnshire. So we think there are opportunities to rebalance that as well.
Just sort of to summarise, what would you say are the benefits of the STP, and can you give some examples of how it will benefit the local population in Lincolnshire?
Well, it all remains to be seen, doesn't it? Because it's relatively early days in that 5-year plan. As I mentioned earlier, there are many proposals that were still yet to bring forward. But the purpose of the STP is to address these 3 really significant and tricky issues that we face. We absolutely know that the quality of care and outcomes for patients, whilst it's good, and I must say excellent in some services, as a system it isn't good enough. We know we're really struggling in terms of our staffing numbers, and we know that we're spending more money than actually we're being given on the healthcare. So the STP is about trying to remodel what we do so that we're in a much better place on all 3 of those measures. Having said that, there are certain things that I would like to point to as early successes, such as the GP international recruitment piece, such as the early development of neighbourhood teams, and certainly up in Gainsborough, which is been leading the way for us in the county. There's some really promising changes that are beginning to come through. Also on mental health, the team have done a lot of work on mental health. A particular issue that we faced in the county is a very high proportion of people with mental health, if you like, urgent needs. We were requiring to go out of county for that care. And that isn't kind of just into Nottingham or Peterborough. I mean, that's having to go much further afield, which is very poor for them, for their families, and it doesn't particularly help them return to better health. So the Mental Health Trust, LPFT, has done some great work in establishing a new male psychiatric inpatient care unit, which opened last year in Lincoln. More recently, they've opened a clinical decisions assessment unit, which is all about providing better mental health services in Lincolnshire for Lincolnshire populations. So we can already, I think, point to some really positive developments there.
Yeah, good. So what would you say to reassure patients that they are being listened to and they can make a difference to the services they receive in Lincolnshire?
Well, we continually listen to what the populations say, and there's a vast network of ways in which we do that. Obviously, Healthwatch is one avenue. We have all of our patient participation groups. We're happy to talk widely with all sorts of groups and bodies. I attend on a regular basis, for example, the Health Scrutiny Committee, and share our thinking and our plans for the future. I must say that I think we in the NHS have got much more work to do in terms of how we openly and authentically engage with the population we serve. So whilst we're really keen to listen and share things with people, we're very clear that we need to be even more proactive going forward around that. And that's a key part of what people will see in 2018 as well.
So it's a case of watch your space for these plans and to really get involved and encourage sort of other people, patients, to be involved in that process.
Absolutely. There's sort of there's no secrets. We're not doing this behind closed doors or anything like that. We're very open to the views of the population's representatives, and of course the views and insights of our own staff. So again, what you'll see in 2018 is as ideas and proposals start to come forward, they will incorporate the views and the perspectives of senior clinicians working in the service, as well as, importantly, the views of independent external bodies and their advice in relation to service configuration.
So what do you believe is the biggest challenge the NHS is facing today? I think you probably alluded to some of those areas, but
gosh, it's almost impossible to pin one down. But just kind of stepping back from some of the details I've shared with you, the biggest issue I think facing the NHS as a whole is the way in which the demography of the population is changing. I understand that the average life expectancy today is something in the order of 15 years longer than it was when the NHS was set up in 1948. I mean, it's just remarkable, absolutely remarkable. But when you think about it, that means that we have many more 70, 80, 90-year-olds. The number of people passing 100 is greater than it's ever been. Many of these people are living well, but many require additional support from the NHS, be it in issues to do with mobility, diabetes, asthma, heart disease, dementia, of course. So I think the real challenge for the NHS, notwithstanding issues about quality and money and staffing, is how we're able to support the population as a whole, but obviously the increased life expectancy of the population in the best possible way. We're not alone in this problem. It's the same across the Western world, but I'm not convinced that we've truly sort of got our heads around how we're going to do that, and it will require a sort of integrated effort across the whole of the public sector as well, because clearly it influences social services, housing policy, so on and so forth. So that's arguably one of the biggest challenges for the country, let alone just the NHS.